Impact's Health and Wellness Show. Today we speak to Andrew Wu. He's the co-founder and CEO of MeshBio. MeshBio is addressing the growing global burden of chronic diseases. Now, due to an aging population and also a shortage of primary care expertise, the company provides advanced predictive analytics clinical software solutions for personalized risk assessment and health management. Now, to tell us more about this, Andrew, welcome to the show.
Hi, Brian. Thank you for having us. It's our pleasure to be here and share a little bit about what we're doing and how we're helping healthcare providers help their patients.
Okay, and give us a start then and give us a quick overview on MeshBio, its history and the reasons behind its founding.
Yeah, so MeshBio was started at the end of 2018. My background is in clinical diagnostics. I've been developing clinical diagnostic instruments, clinical diagnostic lab services for much of my career, more than a decade. And we saw that there was a real challenge in terms of the volume and complexity of data that healthcare providers were receiving, right? As we know, healthcare providers, their responsibility is to patient care, but due to time pressures and especially what we face in Southeast Asia is a lack of doctors. Doctors have to very quickly triangulate what's currently going on with the patient's health and to figure out what to do next. And this is where my co-founders and I realized that there was a huge opportunity and a great clinical need to enable and empower our physicians to do their best work, right? To augment all of their years of clinical experience and judgment, simplify the data streams that are all at their disposal, and to ultimately support the decisions that a doctor is going to make for the next steps in the patient's care journey. And this is when we started our company in 2018, at the end of 2018, and had the great privilege to work with some of the leading healthcare providers, starting in Singapore, but now with our regional expansion, countries across outside of Singapore as well, across the Southeast Asian region.
Now, so here's the thing, Andrew. Chronic diseases is a huge problem, isn't it? And really, it's been identified at a macro level, really, by governments as an area of great concern because of the cost involved really in treating and managing these diseases. Tell us about some of the challenges around chronic disease management on a macro level.
Yeah. So maybe let's take a step back and think about why chronic disease, as you mentioned earlier, is such an area of both social concern, economic concern, and political concern. Right? Asia is experiencing increased longevity with urbanization, changing lifestyles, changing demographics. There's an increasing burden of chronic diseases as our populations change and grow older. And the need to manage chronic conditions like diabetes, hypertension, cardiovascular disease, like heart disease, has never been more crucial. So take the largest country in Southeast Asia, for instance, Indonesia, right? A study by Lancet showed that chronic diseases continue to affect the health of many Indonesians. Factors like high blood pressure or elevated blood glucose, increasing weight or BMI are leading risks contributing to loss of health or shortening health span. And in terms of poor quality of life, disability, or in technical population health speak, disability adjusted life years. Right?
Okay.
So of course, these risk factors lead to chronic diseases like diabetes, obesity, hypertension, and heart attacks, right? With increasing longevity as populations grow older, the imperative to address not just living longer, but living healthier for longer, the health span, it becomes increasingly urgent and increasingly important from a health policies perspective. Now, of course, this trend is going to continue to grow as population size also increases and demographic and economic shifts mean that there is a growing segment of the middle class population with changing lifestyle habits getting more chronic diseases, right? So it's very critical for us to look at different ways to combat the growing disease burden from these conditions, whether it's from a prevention or from an intervention or treatment front.
Okay, so this is where predictive analytics comes in, isn't it? Because the whole idea of that is it's going to play. If you can predict what is going to happen with certain populations, certain demographics, and so forth, you can do earlier interventions and then change outcomes. Could you walk us through the impact of predictive analytics on a couple of key stakeholders, individual patients, medical practitioners, as well as on a macro level, healthcare systems and governments?
Wow, that's a lot to unpack.
Yeah, so you unpack them one at a time.
Yeah, so maybe let me take a step back, right? So thanks to fairly well-established guidelines, decades of biomedical research, we understand how these chronic diseases occur. We understand how they progress and why certain individuals do better. And we're able to predict with very rigorous clinical risk scoring methods that have been validated globally, and very extensive, thousands of documents worth of guidelines on how best to deliver that effective care to these patients. But of course, the volume of this information and the algorithms around risk prediction still remain challenging to implement on a systems level, provider level, and certainly on an individual level, for a number of reasons that I mentioned earlier, right? The doctors are under tremendous pressure to turn around patients, to figure out what's going on, and then to decide on a treatment. And doing this for, in places like Indonesia, where doctor-patient ratio is very low, it's typically like 10 patients an hour, for instance, right? So almost 100 patients a day. So when it comes to chronic disease management, it's very multifaceted, right? It's very dependent on the different risk factors that a patient might have. As I mentioned earlier, we understand how these things happen. So why couldn't we use the distributed power of computing, right? Especially as more and more health systems are getting digitized using electronic medical records, use predictive analytics to analyze these data streams, to predict what's going on in the patient, what's the likely trajectory, and because we understand how these risk factors contribute, guide the physician, support his clinical judgment and experience into zooming in the most effective areas, most effective interventions to prevent adverse patient outcomes like kidney disease and diabetes, or heart attacks for people with high cholesterol. And this is why we're working with healthcare providers across Southeast Asia, like, for instance, our collaborator in Indonesia, Pramita, to embed predictive analytics into their care infrastructure. So this works in three ways, right? Firstly, we ingest and structure data, right? So in healthcare, this might come from the patient's own health history that's embedded in medical records, the diagnostics that comes from the clinical laboratories, all the instruments and all the data that comes from blood tests, and even from imaging, right? So ultrasound, X-ray, MRIs. And by structuring and ingesting this data, we ran through a very transparent, trustworthy clinical analytics engine that incorporates all of the best practices, clinical guidelines, and risk assessments that help healthcare providers assess patients based on these gold standards. And then we then guide the next steps of the patient's care journey by generating actionable insights, supporting the doctor. For instance, the biggest contributor to your elevated heart attack risk is elevated blood pressure. So we really need to be thinking about how your lifestyle changes, or even maybe clinical interventions or medication that you can be taking in order to address the main driver of risk of heart disease in this particular patient, because blood pressure is the main driver. But it's
also one of the things, and I've got to interrupt you here, because the reality is the following. What if you do aggregated data, your ability to then predict how certain patient types or certain environmental conditions in certain geographical areas will certainly differ from others. So you would probably have to localize that data plus run the analytics, and then the treatment outcomes and targeted therapies should be then, correct me if I'm wrong, if that's how your algorithm works, there specific to that particular population or region?
That's a very good point, Brian, and that's something that we take the duty of care and responsibility very seriously. MeshBio has undertaken the approach to build foundational understanding and intelligence around care pathways, best practice guidelines on an international level. Of course, each country, based on the specifics of the population, the environmental factors, the socioeconomic factors, would have national guidelines, right? National best practices that are best suited to their constituents, right? Then, of course, each healthcare provider, depending on the infrastructure and skill level available at each organization, would then have specific interventions. So, for instance, in countries, once again, like Indonesia, an MRI machine might not be so readily available, right? Whereas CT scans might be much more available, or ultrasound, right? So maybe the next best thing for the patient would be to undergo a deeper investigation with a CT scan or with an ultrasound, because an MRI might not be available. But for instance, in countries where there is more infrastructure available, like Singapore or Hong Kong, maybe it's logical then to follow up initial triage of a patient's condition by follow-up testing on an MRI. So we would customize the guidance of the next steps of a patient's care journey based on what's best practice in the country and focused on what's available and what makes the most sense for the patient within the context of a country, within the context of a healthcare provider.
Okay, and that then makes very logical sense, which brings me then to your predictive platform, DARA. Tell us about the experience that you've had in Singapore so far, and then how you're using that to then leapfrog to the other markets.
Yeah, so we've been really privileged to work with some of the largest health screening or medical checkup providers in Singapore, early adopters who saw, firstly, the imperative to deliver preventive health, right? Especially in Singapore as our populations get older. And the drivers are not just from the provider side, but also corporates, right? Employers are also recognizing, and we were just talking about how HR functions in companies are much more concerned now about the overall health of the employees under their care, right? So DARA does a few things, right? Certainly, we are able to triangulate a patient's health and summarize the key findings from the patient's health status, right, for easy interpretation and easy understanding by automating a lot of this complex analysis on an individual level. Now, this, of course, follows up by a whole host of clinical scenarios. We now cover more than 7,000 different clinical scenarios to guide the next steps in terms of clinical interventions or recommendations or lifestyle changes for the patient.
So,
right?
Andrew, can I stop you and ask you at this point of time, from a Singapore context, where did the base data come from DARA? Did you take historical data and load it and let machine learning and AI take its course, or how did you build that knowledge base?
Yeah. That's a great question. So we have taken the approach of building our knowledge base from a few different building blocks. Firstly, Singapore has invested a lot in population health. We have a lot of information about the demographics and what are the drivers of disease and very specific guidelines around preventive health in Singapore. So we've built all of that into DARA, and we've taken the approach of focusing on explainable models, explainable rules-based, knowledge-based analytics, as compared with neural network or purely machine learning type approaches, because our objective is to support doctors' clinical decision-making, and building that trust and explainability is critical to adoption and utilization of our tools, of our platform by physicians, right? If the system makes a particular assessment about a patient with, for instance, 10% cardiovascular disease risk profile over the next 10 years, we need to know why, right? What is the basis of these calculations? What are the input parameters, and what can be done next for the patient? Because it's not about how clever is the technology or how extensive is your neural network. It really boils down to, can we trust it for clinical decision making? Because ultimately it's about delivering impactful, actionable care that influences patient outcomes.
And that's the impactful, actionable, and that influences patient outcomes. And I think that's a very important thing, which brings me to a question also around the fact that in Southeast Asia, as you mentioned at the start of the interview, really where the doctor-patient ratio sometimes are challenging, to say the least. Won't your solution then aid outcomes, especially from a telehealth perspective and remote treatment of patients?
That's a great point, right? So we certainly see the emergence of remotely delivered care through telehealth, through mobile, even through Zoom, even rising, especially after the COVID-19 pandemic. I think this has made healthcare much more accessible, and we're glad for these foundational infrastructure changes, right? So when we think about the changes in healthcare and the opportunities and impact that digital technologies or digital healthcare has made, foundational to this is electronic medical records, right? The digitization of healthcare data, and telehealth as ways to improve access. No more queuing for 1 hour outside a GP's clinic before you finally get to spend 10 minutes to see them, right?
Yes.
On the on-demand access to clinical expertise. At the same time, we have a growing trend of consumerization of healthcare, increasing awareness, even wearables amongst many of our middle-class consumers now. But what we really need is the layer of intelligence or analytics solutions, such as what MeshBio provides, in order to connect up all these various data streams to direct, for instance, making more sense out of data coming out from the electronic health records and directing patients through telehealth, right, to more frequent follow-ups, or even directing them towards specialist care. And the specialist might not even be in Singapore, right? It might be a Malaysian patient seeing an initial consultation with a specialist in Singapore through telehealth before deciding whether to have a deeper face-to-face interaction. So certainly telehealth is a big enabler of access, and predictive analytics technologies, health intelligence platforms like MeshBio's DARA is a great engine to direct the delivery of these different patient experiences powered by data.
Now, could you give us a sense of the stakeholders that you work with in Singapore, and then how, and talk to us then, because you now just ventured out of Singapore into Indonesia with PT Pramita, how you're working in that market, which is a completely different market.
Yeah. So I think there are quite a few tailwinds for MeshBio. Firstly, Singapore's big shift towards preventive healthcare. Of course, we have the Ministry of Health is embarking on large healthcare reform with a program called Healthier SG. For those of our listeners who might not be familiar with the healthcare ecosystem, and that really shifts the focus on, rather than reacting to things that might have happened to a patient, an acute incident that's happened to a patient, sick care, so to speak, to really healthcare, right? Thinking about that patient's journey earlier on, right?
Yeah, and that's a huge paradigm shift, isn't it? So it's a wellness paradigm as opposed to an illness paradigm.
That's very succinctly put, Brian, and very succinct, very apt for this show.
Yes.
So yes, so we are shifting the focus towards keeping people healthier for longer, right? Health and wellness, health span and wellness. Now, of course, we know that earlier detection, right, earlier diagnosis and earlier intervention is much more cost effective for healthcare systems, governments, insurers, in the long term, right? So this is where, with these tailwinds, MeshBio has been working very closely with some of the largest healthcare providers in Singapore. We have thousands of patients assessed through our platform every month now, and this is a testament to how we are serving the needs of not just patients, but the facilitators of these patients' cares, the healthcare providers, the doctors, the nurses, and all the allied healthcare professionals. Now, of course, Singapore is it's an important market for us. We are founded and we are headquartered in Singapore, but the need regionally is tremendous, right? And with our early traction and success in Singapore, we understand now how we can deliver the most effective value for healthcare providers to see more patients and deliver this care with more consistency and more quality across their organizations. And as healthcare providers in Indonesia start to think about delivering care for a much, much bigger population. Singapore's population is about 5 million, almost 6 million. Indonesia is about 50 times that, right? They're almost 300 million today. So the imperative for scalability and the opportunity for cloud computing at a scalable level to support clinical decision-making, to support clinical care is tremendous, right? And what's, I guess, different about Indonesia is the push for employers, right? Large corporates, be it foreign multinationals operating in Indonesia or large conglomerates and employers in Indonesia to take proactive care of their employees' health, right? More and more of these corporates are sending their 50,000, 100,000, even 1 million employees for routine and annual or biannual medical checkups to ensure that as they think about delivering economic growth, this economic growth is underpinned by the health and productivity of the constituents, in this case, the employees in these corporates. And that's a big driver of growth for the medical checkup industry in Indonesia. And this is where we believe we have a huge opportunity to contribute and to enable that scalability of quality for healthcare providers there.
And you know, Andrew, that's a really insightful piece of information, because it shows that the employers realize that health is actually wealth, literally, because healthy workforce is a productive workforce, and a productive workforce is a profitable workforce for the company. You know, so really one of the key things is solutions like yours, and of course with the ecosystem that allows these things. For example, you mentioned earlier around the increased sophistication of wearables and the ability to get data right at your home, as opposed to going in previously things like ECGs and simple ECG readings and stuff, which we had to go to a specialist to get. We can get that from a home monitoring piece of equipment.
That's right. That's right. And I would even add that there's an additional element of the transformation of employee health and workforces in these large corporates across the region. Many of them are actually self-insured. So it's not just about growing the top line and productivity of the employees, by ensuring that these employees stay healthy, right? They don't fall sick, and also the potential risk of ill health and the cost to these organizations from a reimbursement from delivering care perspective.
Now, it's been a fascinating conversation, Andrew, and I really enjoyed this. But before we leave, any final thoughts you'd like to leave us with before we end the show?
So I guess my parting thoughts would be Southeast Asia is facing a real era of transformation in healthcare. I think this has been really sparked by the COVID-19 pandemic, realizing that it's not just about addressing the needs of the population when they get a heart attack, right, or building a lot of emergency rooms or A&E. But if the overall population is suffering from chronic disease, ill health, it actually means that our population is very fragile, right? We've learned in the last 3 years that if a population health is fragile, it is the impact from shocks like the COVID-19 pandemic are amplified, right? We know that patients who have hypertension, who have diabetes, who have had history of heart disease do much poorly, right? Did much more poorly during the COVID-19 pandemic as compared to populations that were healthier or younger or healthier, right? So as we age, we need to be thinking about how do we build resilience in our population? And this is where there is a huge opportunity and role for preventive healthcare to proactive healthcare, right? Healthcare as opposed to sick care or ill care.
And on that note, thank you very much for being a great guest. Thanks for coming on the show.
Thank you, Brian. It's a pleasure to be here.
We've been speaking to Andrew Wu. He's the co-founder and CEO of MeshBio from Singapore. And you've been listening and watching the Biztech Health and Wellness Show. This video and podcast will be on our social media platforms as well as our website, www.biztech.asia. We'll also be on our syndication partners, TV stations, radio stations, and websites. Thanks a lot for tuning in.